Start by talking about the core components of therapy at the Family Attachment Center. The key to repairing the attachment process is discovering the child's internal working model and challenging or shifting existing beliefs that they have about themselves, others, and relationships. And this is a process of attunement, regulation, and repair. So what we're trying to do is shift what they're holding in their minds. So therapy is focused on facilitating the child or adolescent's ability to self-regulate or to accept regulation from their parent in a process of co-regulation. No parent is perfect, including myself, but the process of attunement and regulation or misattunement and repair leads to the formation of an internal working model. And in a secondary family, it is a reformation of that model or repairing of that model. And in our system, we are using attachment narratives, parent narratives, play, regulation techniques, attunement techniques, all of which I will not have enough time to talk about. So I'm going to really focus on our narrative techniques. In looking at our model, we're considering three aspects. We are looking at attachment experiences, exposure to trauma, what significant life events or stressful life events have they experienced, and then developmental issues. And in the attachment sphere then, we are looking at what pattern or style do they have. And that's good information, but what we're really after is what is the belief? What does the child have in their mind about themselves and others? And those might be beliefs of, if I'm going to survive, I have to be in control of everyone all the time. You can't keep me safe. I can't rely on you. I can't trust you. I have to keep talking all the time, so you pay attention to me. So those are some of the beliefs that we are looking for. We're also, oops, I just skipped a page. And I'm not going to be able to cover all of these pages in the time I have. But when we're looking at trauma then, complex trauma or the trauma that occurs in a relationship, so multiple experiences of trauma in that relationship, can impair all the psychosocial systems. So there are problems in attachment, there are problems in affect regulation, both emotions and behavior, and in cognition, and in developmental issues, so disassociation that like Anne talked about in biology. So in our model, at the Family Attachment Center, we work with children and adolescents, and often I will say the word child, but I mean adolescent as well. So we work with children and adolescents that are aged 3 to 21 that have been exposed to complex trauma, and they have multiple impairment in many systems of functioning, including attachment. So the clients we work with have internalized a negative model about themselves and about relationships. And as Anne said, we work with clients who just didn't luck out in those first 5 years. And unlike Dina, we work with families that are able to get their kids in the car and come to a clinic. We work with birth families, foster families, pre-adoptive families, and adoptive families that are in a position to help repair their child's model and internalize new expectations and beliefs. So that's a key thing. These parents are in a position to help their child. We recognize the central role of parents in a child or adolescent's life, so we view parents as the experts in their child. They know a lot about that. They can attune to kids in ways that sometimes we cannot. We also engage in a parallel process with families. So we are attuning to parents, assisting them to attune and regulate their own children. Parents in our program are the primary agents of change. And families can opt for an intensive therapy program with a team of therapists, or they can opt for more traditional biweekly or weekly therapy sessions. Other treatment options might include individual family, reflective play therapy, attachment play, parenting techniques, and social skills groups. Again, the key to doing family attachment narrative therapy is discovering the child's model. And the key to discovering the model is listening to parents, because they know, they can articulate that model. So it's the therapist that needs to come alongside them and help them discover what that is. So the role of parents in our program is that they are experts in their child and the primary agents of change. Our role then is to come alongside them in a parallel process, listen to their stories, believe their stories, and understand what it's like to be with a child who is dysregulated most of the day, and help them discover what that unique model is through a process of empathetic inquiry. So we're asking lots and lots of questions, asking them to look underneath the behavior of their child and to discover what's the meaning of the behavior. Where is that coming from? What concept, what belief are they holding in their mind that's driving that behavior, so parents can begin to repair that. And also the role of the professional in this might be some education. Educating the parent about what is normal child development. They might have lost sight of that over the years. Factors that might affect attunement and deficits in brain function that can affect mood or activity or social development. In our narrative therapy, we have 4 narrative types, and this is helpful in structuring the narratives, but just to let you know, very seldom does it come across this way. Parents often combine claiming and trauma materials, or claiming and developmental materials, and claiming and successful child materials. As we discover the child's model, we can help the parents redefine the problem in terms of past attachment experiences, their past trauma, and their level of development. And this alters the parent's view of the child and reawakens empathy in them and allows them to better attune to their child and to get, again, underneath the behavior and figure that out so that we can develop narratives that might shift those internal beliefs. I'm going to kind of let you read your handouts rather than take time, because I've actually brought some parents along with me because they do the best work, and I want to take enough time to show you that. But claiming narratives are designed to increase the security of attachment, to convey the responsive care and protection that the child deserved. Now, we are not erasing the history of a child. We are not saying that this didn't happen or trying to replace it. We're just simply presenting an alternative. Trauma narratives help the child process the trauma, and we're trying to help them develop some coherence around their life story. Often trauma narratives are done in the third person, however, because this creates a zone of safety for the child. We're very sure that the material in the story is not re-traumatizing to the child, because the goal is to, as Anne said, hit that hot spot. We would call it a therapeutic window. We want enough emotion there so that the child is processing and doing the work, but not so much that they become dysregulated, because then therapy stops until things are regulated again. Developmental narratives are designed to teach the how-tos of life. So in some ways, we are supplementing how the child functions, teaching them emotional skills, cognitive skills, relationship skills. And successful child narratives teach values, morals, support conscious development. They can support cause and effect thinking, and they can be a lot of fun. These are also sometimes done in the third person because we do not want to trigger the child's defensiveness or shame. If you sit down and talk with a child about behavior, you know what happens. I don't have to tell you that, and that happens in our clinic as well. So these are fun stories about a girl in a galaxy far, far away who loved adventures, maybe a little too much, and then they go on from there. Okay. So I'm going to move on and show you. This is a trauma narrative. This is a 7-year-old girl who was adopted from China at the age of 10 months. She was abandoned at 2 months and placed in an orphanage until her adoption. She has severe separation anxiety, and her negative model tells her that she is unloved. The story that the parents are doing is from the perspective of the birth mother and conveys the love that she felt for her child. Now notice how the parents really they're painting a picture of what occurred so the child can really envision this and create and develop some coherence around her story. And they're also, if you look at their positioning, lots of face-to-face eye contact. They're touching her to reassure her. And that often occurs in stories where parents will hold their children, touch them, make eye contact, but not at the expense of regulation. So if the child does not want to do that, if the child wants to sit across the room, that wouldn't be we would rather have them sit closer, but again, we're looking at regulation and trying to keep the child regulated.
was just saying, I can't just do that. I can't take my baby somewhere and let her in the woods and let wolves get her or something. So then he was like, well, tomorrow we're going to do it for you because the government people are coming and this is what you have to do. You have to do this. And the mom felt so pressured she didn't know what to do. There was nobody she could really talk to because she loved her baby. The last thing she wanted was for the baby to go away, but she also knew, well, she had to live. And it was like, what am I going to do? So she had no idea what to do. So, this is what she did. So overnight, about 2:30, 3 o'clock in the morning, she picked up Rose, bundled her up. And she dressed her up really warm. She had a hat on. She put mittens on. She put big clothes on. And she took a big basket, one of those kind of folding laundry baskets that are really comfortable that they have a handle on. You know what I'm talking about? And he took her and she put her in this laundry basket. And she snuck out of the house and nobody knew about it. Not even her husband, not even the parents, nobody. And she started walking. And it was really far into the village because they lived kind of out in the country because she knew it would take her about probably 2 hours to get there by foot, but she didn't care. And so she walked with her baby, and every now and then Rose would kind of, you know, she'd stop every now and then because Rose would cry, and she'd comfort Rose and hold her face and maybe breastfeed her too because she was breastfeeding at that whole time to give Rose, the baby, some food. And then Rose would calm down and go to sleep again, and she'd put the thing again. And so she walked all the way to town, and when she got there, 5:30 in the morning. It was really early in the morning before anybody was up. There were a few people every now and then walking by, but she walked until she found the police station. And because she was saying to herself, you know, I'm not going to let my baby die. I love my baby. And she had decided in her heart that it was too much pressure. She couldn't keep her. She just knew that because she had to think of her whole family. And she was so sad. It was like the thing that she wanted to do the most was to say, look, you know, she didn't know what to do. She was just not sure, but she knew she didn't want her baby to die. And she thought of a plan. Her plan was to take her to this police station because she thought, you know what, I'm going to put this baby in a place where somebody will find her. I'm not going to stick her out in the woods, or I'm not going to, you know, dump her anywhere. I want to know that if I can't take care of this baby who I love, that somebody else will. And so what she did was she put Rose on the doorstep of this police station and walked away. And where she walked across the street, and she walked to a place where she could sort of hide but watch Rose the whole time. And when she put Rose down, Rose started crying and crying and crying. And the mother didn't know what to do. She was just sobbing. She was over in the corner just crying because she knew that she'd made this decision and that she couldn't go get her at this point because then people would know. Because it was also against the law to leave your child someplace. They couldn't make adoption plans in adoption at that time, or adoption plans for people at that time. It was a law against that. So the mom, you know, because then she could have made an adoption plan and that would have worked out great, but they didn't even have that. So she was stuck there. So this was her way of making an adoption plan. She knew that somebody would take care of Rose, but Rose was crying and crying and crying. And she wanted so much to go over there and comfort her and pick her up and hold her. And you know, babies, when they're just little, like when they're just a few months old, that's how they feel secure, is when they cry, the mom comes. They cry, and mom comes and feeds them or whatever. Well, mom didn't come, and Rose got redder and redder in the face and starting to be really upset, and the mom was crying, but she waited, and then pretty soon, somebody heard her cry on the street. They said, look, there's a baby. And all of a sudden there's a crowd, and everybody's looking at baby Rose, who's looking it up like, okay, who are all these people? And she's still crying. And then someone went into the police station and took the basket in. And then she went and they took her inside. So then the door closed, and Rose's mother thought to herself that she'd done the right thing, because she knew that the situation that she had was so hard, and she had to make some decision. And the decision she made was to get her child to a place that was safe. And so
Okay. I think you got the gist of what she was trying to do with that story, is really present an alternate belief that this child was not unloved, even from the beginning. And this is the type of work that I get to see every day, and that's why I love my job. Those stories are not scripted for parents. We certainly talk about how they might construct stories, but they take these ideas and they go with it. And most of them go in there without scripts, without notes, and just talk from their heart. And that's what we really want parents to be able to do, is to determine that inner model, attune and regulate their child, and then help them feel safe and secure, help them process through past events, and develop a different narrative, kind of a restoring of their life. What we see clinically as far as outcomes, we often see changed beliefs and expectations. So we go from, I need to control everyone all the time, to maybe parents can be helpful. Maybe I can let them be in control of this. Maybe if they love me when I set the barn on fire, they might keep me. Maybe I'm not so bad. And we see changed beliefs in parents as well, because they are now focusing on something other than behavior. They are focusing underneath. And so they are saying, well, of course they're going to create chaos. That's where they came from. Or of course they're going to talk constantly, because if they don't, they're scared to death that I'm not going to pay attention and I'm going to forget them. So we're looking at that. Some of the challenges we face in therapy might be the parents' own stuff, because they have their own attachment history, they have their own attachment, their inner working model, and that might get in the way. Some of our parents have a trauma history as well. Sometimes they'll get back into focusing on behavior rather than focusing underneath. Sometimes the child will lapse into old behavior patterns when a new stress comes up, if the teacher goes on maternity leave, for example. But the biggest thing that can get in the way, the biggest challenge in our model, is an overactive therapist. If we don't stick with empathetic inquiry to bring out their expertise and help them attune and regulate and do the narratives, then they will put us in that expert chair, and they will come in saying, well, what do we do today? You're the expert. But if I empower the parents through questioning, through attuning to them by coming alongside them, then what happens in 2 to 3 days of therapy is they're coming in saying, well, Denise, we're going to do something about this. What do you think? Or they're coming in saying something like, no, that's not good. If I give an idea, that's not going to work. That's not a good idea. And then I know that we're on the right track with these particular parents. And in fact, just last week, I had a parent talk about how her son got nervous during a particular part of the narrative because he reaches over to scratch himself in a certain particular way. But you wouldn't know that because you can't attune to that. Yes, that's a successful outcome. There are challenges in doing research and trying to track. We do pre and post studies looking at behavior, but behavior is not a good representative of attachment repair. So you can track behavior, but it's not a good way to measure attachment. And it's also a challenge in a clinical setting to come up with a control group to do that kind of research. So that's family attachment narrative therapy in a walnut shell, very small. I wish I had more time, but I wanted to give you a flavor. Please contact us if you need more information or want more training.